I was here last October, and my main idea was to be here to respond to your questions, more than to give our points. Because in fact, I mean, the data we are showing are very much already available public evidence-based data. While we want to learn from you, because you are the ones that are leading this experience with this small CWP outbreak. So this is what I'm trying to make clear to you today. For the surveillance, some moment of my project, the risk of CWP, the Ukraine outbreak, all about safety of vaccine, decertification, and what we did. You know that I am a member of the certification board. We are going to meet 30th of May this year, up to the 2nd of June, to close the European story, to close the Ukrainian story. We hope. So let's see some slides. Those are not updated. We are going to update with your new data as soon as we get in April this year. But again, we predicted Ukraine to be at risk already some years ago. We know that Ukraine is suffering for vaccine shortage, lack of vaccine in the last, say, 6 or 7 years. So it's not one day start, it's not one mistake, it's a long-lasting story. And of course, Syria and Israel are the news. We will hear more about Israel. The coverage is very good in the region, and now both countries have reached more than 95% coverage all over the entire region. So ACP surveillance also is going quite well. Both countries do ACP surveillance. Of course, Western countries do prefer to have other kind of surveillance, like enterovirus surveillance. Also, environmental surveillance is being done in the region quite intensively, but we want to promote environmental surveillance to do more. Also, Ukraine is doing for many years environmental polio surveillance. And the index, as you see here, the green area is going relatively well. But of course, in the Western country where ACP is not practiced, the index is not that high. And again, still a large part of the East area is using OPV, while the West countries already switched, some of them for many years, to full IPV practice. I was 6 years ago in Tajikistan. I didn't even know what Tajikistan is. I am a Napolitan from Napoli. What can you imagine? Pamir Mountains. Unbelievable. But I was there 2 months to lead a WHO team in response to an outbreak. And it was a terrible outbreak. Incredibly terrible. A country without polio for more than 20 years. Then immediately flushed with hundreds of cases that, as you know, mean hundreds of thousands of infected. Because for each case you have many. Beautiful countries, high mountains, beautiful people. That's some of my secretary present for a minute. And this was the outbreak. So an incredible big outbreak, like a land never seen a vaccine. Like there was no vaccination at all. What was not the truth, because in fact they reported high vaccination coverage. Some of them were false numbers. And you see that the outcome was terrible. We had many hundreds of cases of all age. We had even a man of 65 with polio. So not only children, all ages were and I was quite tired in doing this. And also we had many deaths. Preventable deaths. This was a criminal situation. You can imagine in the middle of Europe, in the third millennium, we had children dying for polio. It was really impossible to believe. But this was the case. It was a terrible story because we didn't imagine even that it could happen in the European region. And we, as certification board, we certified this region completely polio-free 2002. So 10 years before, we were totally safe. But we were wrong, because we didn't know exactly the situation like it was. What I want to underline is that the response was incredible. When we launched an OPV campaign, all the mothers dressed with the best dress their children, and they brought to the vaccination center. Millions. The entire Tajik population is 7 million. We gave more than 14 million vaccinations in less than 4 months. You see, this is it. And you see the last line of this last line, coverage rate of the round, 99.4, 99.4, 98.8, and so on. So, in a land without newspaper, in a land without TV, in a land with, very basic sanitary situation, we had an incredible response. And everybody was convinced that polio could be eliminated. And believe it or not, as you see from the graph, it was water on the fire. Immediately, the epidemic was stopped, and we were really satisfied with the huge, incredible, and very positive results. And we know now that Tajikistan is now going on a good routine situation, which vaccine is normally given not only for polio, but also for the other vaccine preventable disease, routinely every day, every week, every month. So when we speak about vaccine, I want you to consider one moment. We have been educated to see vaccine preventable disease as one of our medical profession targets. Yeah, what about the conversation in the court? Mamma mia. Hey, guys, can you listen? No? Can you? Ciao, buongiorno. Thank you. I'm sensitive. Okay, so we consider disease, but now we have to change the concept. Our children have a basic human right. The right not to be affected nor to die by a vaccine preventable disease. Like we have to guarantee the people safe water, like we have to guarantee the people basic education, like we have to guarantee the bread. Every day, we have to guarantee that our children do not suffer from vaccine preventable disease. When we have a case of measles or a case of polio, this is a criminal action against our children. It's a criminal action, and we, medical people, are responsible. We should be brought to the court, because we did not prevent that disease to occur. We could have done it. Okay. Tajikistan exported not only nuts and figs and kefir, they export, but they also export polio in 8 countries. And the 8 countries resulted in similar SCIAs, Russia, Turkmenistan, Uzbekistan. They all made campaign, all of them with 99, 98 response. So incredible positive response. And let's be just shorter, because Steve already mentioned the risk of CDVV. So, again, we already know what we speak about, and we know that each child has this nice habit to excrete vaccine once vaccinated for many weeks. This vaccinates the environment and all the siblings. And, of course, VDP developed through a series of mutations, like Steve explained. This take more than 1 year. So when we have 2 cases in Zadawal Pak, the message is that the virus was there at least for 1 year before the cases. At least for 1 year. Because to become a CDVP, he had to accumulate different number, 16, or I don't remember the number, of mutation, up to became pathogen. So, not 2 cases. How many cases in that region? 2,000, 20,000, we don't know. And again, the critical factor is the duration for the vaccine circulation, and again, the lower vaccination coverage. And we know from your data, from your report, annual, that it's now 6 years that Ukraine denounced a very, very low vaccination rate, official figures. not to speak about unofficial things. That also are there. You know, yesterday I was to a lunch in my house in Stockholm, and there were several ladies, friends of my wife, that she made this gathering, you know, she made some pasta forno, magnifica for her friends, and one of them was Ukrainian, married to an Italian in Stockholm, and she said, look Donato, my friends in Kiev, they say, if you want to get vaccinated, you go to private doctor and pay. Because state vaccines are wrong, or they are none. But if we pay to the private, is that true? Is that possible in this evolved European country? Impossible to believe. Why you need to go to private to pay for the good vaccine, and the state vaccines are wrong? That's a stupid idea. Incredibly stupid. Anyhow, let's go back. So, we had a lot of CDVP outbreaks. The first one was in Hispaniola, in the Americas, in the Philippines. We had, 24 CDVP outbreaks with more than 750 cases parallel. So it's not nothing new. It's not novelty. It's something we deal with. We know very well. We studied for many years. So what happened in Ukraine? Unfortunately, we were easy predictors. Because a few months before the cases occurred in Ukraine, we wrote this statement. In Sarajevo, in June last year. FIM believes that there is strong potential for a very large outbreak of polio in Ukraine. Easy to predict, because we knew the data, the official and unofficial data, and that was easy to do. Also, you have what we call a gradual accumulation. Even if you have 80% coverage, that means that 20% are not covered this year. Next year, other 20. The other year, other 20. So you accumulate cohort of unvaccinated. That was the story of Ukraine. You have been accumulating tens of thousands of children not vaccinated. Susceptible population. That was the reason. So the outbreak is to be stopped. Now, if the outbreak, this outbreak, is not stopped in 6 months, the entire 53 regions are not anymore polio-free. We have to restart the certification process for 53 European countries, from Vladivostok to Coimbra, from Russia to Portugal. We have to restart everything again. I will retire. I'm not going to do that. I go to my farm, I go to my own business, but I don't want to repeat again my 20-year story of work with Americans. So, this is the independent monitoring board. Again, another easy prediction. Now, the global independent monitoring board. For some time, Ukraine has been a catastrophe waiting to happen. Easy to predict. So everything was announced. It was not an unexpected event. You know, the new polio strategy defined grades of a polio event. And Ukraine was classified grade 2, because luckily enough you did not export polio in other countries. The thing was confined in a single area. But again, it was similar to Tajikistan. So 2 cases, some people say, we only had 2 cases last year, then nothing else. Why we bother about polio? What is the reason? The thing is over. Is over? Are we safe that it's over? Because we at least had 2,000 infected at that time, last year. Then who is going to guarantee us that the virus is not still circulating today without provoking any paralysis? Who guarantees that the next month another polio case pops out? You heard from Steve that some cases are 11 months, 12 months after each other. So what is the guarantee that you do not have a polio case next week? I don't want to predict anything wrongly. I'm sure it will not happen. But no, how many more should be infected before we react positively and we cover the gap of vaccination coverage? How many more? We want to wait for the next paralysis? No, we don't want to do that. Many Ukrainians travel west and east. Italy is full of Ukrainians. We have about 200,000 Ukrainians working in Italy today. Okay? Do we want to have people that excrete CDVP without being affected? No, we don't want that. We don't want that. But we don't want to build a wall against Ukrainians. No, we don't want to do this. Is OPV safe? OPV is dangerous because it's mutant, it's dangerous, it kills people. Well, many billion doses given in the last 50 years. One paralytic case every 2.7 million doses. No case of polio in subsequent OPV doses. No case of polio population primary with IPV. Who is guaranteed this? The vaccine. Where they come from? All the OPV vaccines come from this source, including OPV procured through UN agencies. WHO, UNICEF, and must meet expert committee biological standards. Very rigid. Specifications govern the exact contents and exclude the presence of other things. Cannot be that we feel a little bit of HIV or otherwise into the vaccine. No, we don't put the pizza in the vaccine. We don't do that. So the vaccines are very, very safe. The specification make it impossible for OPV to contain other undeclared biological active substances. And you know that there are rumors of this. The vaccine procured have to meet this specification. Even the privately produced, any company cannot sell without this. Okay? Pre-qualification of vaccine. 19 countries of this region still use OPV. I am now 69. Next year, 70. And I do not know any other drug, any other medicament more controlled and safe than OPV vaccine. In my history, I do not know. I'm not in private. I'm a public health person. I have no conflict of interest. But I know no other evidence for any other drug that has been controlled and it's lot by lot and safe as the OPV vaccine. No question, no question. This is the evidence, what we call scientific evidence. Then we can be, say, journalist, fantasy, accusing everything, or we can be a scientist. If we are a scientist, we are morally committed to scientific evidence. And scientific evidence comes from the global community, the entire world. So it's not my own opinion, it's not my own conviction. No, your opinion is nothing. Your opinion is good if it matches the global scientific community. We have many false contraindications. That's another impediment. The child has cough, has runny nose like I have now. We postpone vaccination for no reason. And any country has this list. This is one of them. I took the Australian one, but can be hundreds of them. That really indicate if you are treated with antibiotic, if you have asthma, if you have pertussis like it, you can be vaccinated. You must be vaccinated. So a lot of false contraindications. Please instruct your doctors. This is good for polio, but also it's good for other vaccines. Many vaccines are not given for stupid reasons, or because doctors do not want to take responsibility, and they are paid for that. Now let's go to my mission of polio certification model. So what we need to get from Ukraine to close the story? Simple. The absence of any polio virus for 3 years in the entire region. Okay? The presence of certified standard surveillance in all countries during these 3 years. The completion of phase 1 as biocontainment. And we did this in 2002. So 14 years ago, 53 countries, including Ukraine, were okay with this. And we signed If you take the certificate, this is my signature, Donato Greco, together with 8 others, and we said that this was true. Were we right or we were wrong? Now, in June, next month, May 30, we have to retake that certificate and ask ourselves, is this still valid or is it being broken by Ukrainians? This is the process, very simple. The certification is not born in Copenhagen or in Geneva, but the certification is born in Kiev. Because it's the national certification board of each country that certify the country polio-free. We take their votes, we take their word, we trust them. We have some members here, so we trust them. If they say it's okay, we say okay. We trust. We want some evidence, we want some data, we want to see their data, but we do not invent, we do not have fantasy. We go after them, okay? So it's the national responsibility. Minister of Health is the responsible person through the consulting body that is the National Certification Commission. And of course, we regional, 6-word region, refer to global region. And to speak the same language, we fixed some indicators, simple indicators, to trust each other, because otherwise we are treated our work. And the third one, so what we need, you to provide us next month, by the 29th of April, when you go for the final assessment. We need this, you repeat, positive results of the 3 WHO assessments. We need one in the epidemic, one we have done recently, and one we are going to do in April, okay? 6 months of absence of any virus, okay? We need any idea or SCIS to reach at least 95%. Like in Tajikistan. Tajik could do that, Ukraine no? Okay, I cannot believe that. Okay. Routine polio coverage over 95% initial level and at supranational level, each oblast. It's not enough here. We want each oblast, okay? The incidence of FEP, 3 per 100,000. Because this is the index required for endemic, okay? And of course the stool sample, good time. And again, high-level commitment. I was pleased for the President of the Minister, unfortunately he's not here now, but he was clearly committed to this polio story. So I hope that his commitment is transferred in numbers and facts, and everything is okay. But that's all I have to say. But I want to make a conclusion. We are very grateful to Ukraine, because we saw that you have been suffering of problems. If you go to a vaccination center, as I was here in November, in October, several places, and the response was, we have no vaccines. Then what we take? I cannot tell the lady, go out and buy the vaccine for your children. So it cannot be that. If they receive no vaccine, what they can do? So it's clear that you have been suffering of problems. Many of the problems are top-level problems. Political, financial, I don't know, I don't want to comment. But you have been doing very good effort to guarantee the right. Why you have children, Ukrainian children do not have the same right that Italian or French or Spanish children are a different species? You don't want them to be protected against disease? It is a right. And of course, you have a little time to confirm. You have 40 days to close the story. I hope you use well these 40 days.